Hello everyone, this video will help you to learn more about growth and development of infant. I am Dr. Celeste Mary, Vice Principal in Administration at Triplum College of Nursing. Introduction about the topic. The period of growth and development extends throughout the life cycle. Changes occurs from conception to the adolescence. It is important for a nurse to understand the early period as well as the total life cycle of an individual to better understand the behavior of parents and others who provide care of the child. Importance of growth and development for nurses. Knowing what to expect from a particular child at a given age, gaining better understanding of the reason behind the illness, helping in formulating the plan of care, helping in parents' education in order to achieve optimum growth and development at each stage. Moving on to the definition of growth, it is the process of physical maturation resulting in increase in size of the body and various organs. It occurs by multiplication of cells and in increase in intracellular substance. It is the quantitative changes of the body. Next definition is development. It is a process of functional and physiological maturation of the individual. It is a progressive increase in skill and capacity to function. It is related to maturation and myelination of the nervous system. It includes psychological, emotional and social changes. It is a qualitative aspects. Next is principles of growth and development. It is a continuous and orderly process. It is a predictable sequence. Growth proceeds from head down to the tail or in a cephalocaudal direction. Growth proceeds from the center or midline of the body to the periphery or in a proximo-distal direction. Growth and development don't progress at the same rate. It means increased period of growth rate in early childhood and adolescence and decreased period of growth rate in middle childhood. Not all body parts grow in the same rate at the same time. Each child grows in his or her own unique way. Each stage of growth and development is affected by the preceding types of development. Continuation of the principles of growth and development. Different patterns in the body grow at different rates. Development depends upon the maturation and myelination of nervous system. The sequence of development is same for all children, but the rate of development varies from child to child. Development is a product of contribution of hereditary and environment. Moving on to factors affecting growth and development. It depends upon multiple factors or determinants. It may influence directly and indirectly by promoting or hindering to proceed. First is genetic factors and second one is the environmental factors. Under environmental factors, prenatal factors and postnatal factors. One of the important factor which affects the growth and development is hereditary factor, that is genetic predisposition, which influence the growth and development of children. Sex. There is a difference between male child and female child of their growth. Race and nationality, which also affects the growth and development of the children. Second factor is the environmental factor, under that prenatal factor and postnatal factor, which includes factors related to mothers during pregnancy and factors related to fetus. The examples of factors which influence the growth of the fetus is maternal malnutrition, maternal infections, maternal substance abuse, maternal illnesses and like hypertension and diabetes mellitus, hormonal imbalances, miscellaneous conditions like placenta previa, etc. And examples of factors related to fetus is malposition in uterus, abnormal placental implantation. All these examples which influence the growth and development of the children. Postnatal environment, which classified as external environment and internal environment. The examples of external environment are socio-economic status of the family, child nutrition, climate and seasons, child's position of the family, number of siblings in the family and family structure. All these examples which influence the growth of the children. And the internal environment examples, the child intelligence, hormonal imbalance, emotional factor which influence the hinder the growth and development of the children. Moving on to the topic growth and development of infant. It is the period which starts at the end of the first month up to the end of the first year of the age. Infants' growth and development during this period are rapid. First one is the physical growth of normal infant. Under that weight, the weight gain ranges from the birth to 4 months. It increases to 750 gram per month. 5 to 8 months, it increases to 500 gram per month. And 9 to 12 months, the ranges from 250 gram per month. The infant will double its birth weight by 4 to 5 months and triples by 10 to 12 months of the age. For calculating the expected weight of the child, the formula is age in months plus 9 divided by 2. Example, if the child age is 7 months, 7 plus 9 divided by 2 is equal to 8 kg. Next, we can see about the height. Height increases about 3 cm per month during the first 3 months of the age, and then it increases 2 cm per month at the age of 4 to 6 months, and 7 to 12 months it increases 1.5 cm per month. And about the head circumference, it increases about 2 cm per month during the first 3 months, and then half centimeter per month during the second 9 months of the age, and the posterior fontanelle closes by 6 to 8 weeks of the age, and the shape of the posterior fontanelle is triangle in shape. Anterior fontanelle closes by 12 to 18 months. The shape of the anterior fontanelle is diamond shape. And about the chest circumference, by the end of the first year, it will be equal to head circumference. Moving on to physiological growth of infants, the normal range of pulse rate is 110 to 150 beats per minute, and about respiration 35 to 40 breaths per minute, blood pressure 80/50 mmHg. Next, about the dentition, the eruption of teeth starts by 5 to 6 months of the age. It is also called as milk teeth or deciduous teeth or temporary teeth. The total number of temporary teeth is 20. Next type of development is motor development, which includes gross motor and fine motor development. The normal gross motor development is the child attains the head control at the age of 3 months. 5 months the child rolls over, sit with support at 6 months, sit without support by 8 months, and standing with support by 9 months. The stand without support by 12 months. And the key fine motor development is the child reaches out the object with both hands at 4 months. Reaching out the object with one hand is at 6 months. Immature pincer grasp will attain by 9 months. Pincer grasp mature, that is at the age of 12 months. And then about the social and adaptive milestones. At the age of 2 months, the child attains the social smell, and 3 months, the child recognizes the mother, and at the age of 6 months, the child has the stranger anxiety and recognizes the strangers, and 9 months, the child waves the hand bye-bye, and 12 months, the child will come when we call it by name and play the symbol ball games. And moving on to the language development, at the age of 1 month, the child alert to the sound, and 3 months, the child makes some musical vowel sounds, and 4th month, the child laughs loud, and at the age of 6 months, monosyllables words ba, da, pa sounds will be produced, and 9 months, bisyllables words mama, papa, dada sounds will be produced by the child, and the age of 12 months, 1 to 2 words with meaning will be spoke by the child. Next, we can move on to the emotional development of infant. The child learns crying brings the attention, and according to Erikson, the infant develops the sense of stress versus mistress. Though the infant's interaction with their caregiver, especially the child will be trust with the caregiver and during the feeds and learn to trust others through their relief of basic needs. Next about the topic, some of the abnormal signs or red flags in infant development. First one is unable to sit alone by the age of 9 months, and the child will unable to transfer the object hand to hand by the age of 1 year. An abnormal pincer grasp or grasp by the age of 15 months. The child can't able to walk after 18 months, and failure to speak or recognize the words by 2 years. These are some of the red flags or abnormal signs of an infant. Thank you.